Dear NEET UG aspirants, if you are preparing for NEET UG 2026 and if you are new to this channel, you subscribe the channel because you will get important MCQs solved in this channel, and I will upload more and more videos on NEET UG biology topics so that you can crack NEET UG biology very easily, so that you can come into the field of medicine. Myself, Dr. TN Debnath, a doctor of modern medical science, motivational speaker, and life coach. I have done my MBBS as well as MD psychiatry, and also I did postgraduate diploma in clinical pathology. So I can assist you how you can come to this field of medical science. So if you are seriously preparing for NEET UG 2026, then definitely this channel is for you. Now in this video I will talk about oogenesis. In earlier videos I have talked about spermatogenesis. In this video I will talk about oogenesis. And definitely oogenesis is little longer and little difficult, so you need to give more attention to this video. Now, if you look at the spermatogenesis, usually spermatogenesis start at the puberty, but here oogenesis usually start at embryonic age. Oogenesis start at embryonic age. That is very important. Embryonic age or embryonic development, that is starting of oogenesis. Now, if you look at this diagram actually now you will feel little confused. But if you listen the lecture very carefully, then I will describe the diagram, then it will be very easier for you. So, let us start for oogenesis. Now, as I have said, it started in embryonic age, right? It started in embryonic age. What we call it? Oogonia. Oogonia. Now, remember, oogonia actually, the number of oogonias are couple of millions. Couples of millions. Means it is fixed. Couples of millions oogonias are there, right? Now they will undergo meiotic division. They will undergo meiotic division, and prophase 1, very important, prophase 1, they will form an arrest in primary oocyte. Very important, primary oocyte. Primary oocyte. They will form primary oocyte, right? That will be diploid in number actually. The primary oocyte. Now I will talk about some important follicle. Remember, you need to remember oocyte and follicle, right? It is primary oocyte. Now that primary oocyte, there will be formation of granulosa cell. Granulosa cell layer. Granulosa cell layer. If it is granulosa cell layer, means plus granulosa cell layer is equal to primary follicle. Primary follicle. Very important. Primary follicle. So here one is primary oocyte, one is primary follicle. Now this primary follicle actually it gets degenerated, means it damages gradually till puberty. Till puberty it will damage or degenerate. Degenerate. If it is degenerate, definitely number of the primary follicle will reduce, and at the puberty it will be around 60 to 80,000. 60 to 80,000 primary follicle. 60 to 80,000 primary follicle. There it will be fixed. 60 to 80,000 primary follicle at the puberty. That means there will be no more primary follicle after the puberty. Now gradually that will be reducing in number, and at the particular age there will be no ovulation, no ovum formation, right? It may be 40, it may be some for 45, maybe 50, depend on the age, different age of the patient, right? So the number is very fixed. That is called primary follicle. Now that primary follicle, they will continue the granulosa cell granulosa cell layer, plus they will have more thicker layer. Now if both are there, then we call them as secondary follicle. They we call as secondary follicle. Remember, now we are talking about follicles, that is secondary follicles. That is secondary follicles. Earlier we talked about primary follicles, but earlier we have talked about primary oocyte, right? Remember, you don't confuse between primary oocyte and primary follicle, secondary follicle, tertiary follicle, and mature or Graafian follicle. Now this secondary follicle is there. This secondary follicle, they will go into tertiary follicle. How? Tertiary follicle, if there is a fluid filled cavity. Tertiary follicle, how? If there is fluid filled cavity plus fluid filled cavity. Fluid filled cavity, we call it antrum. Antrum. When I will show in the picture, you will understand. Now you listen. From primary follicle, granulosa cell layer as well as thicker cell layer, then it will be secondary follicle. In secondary follicle, if there is formation of fluid filled cavity, we call them as antrum. So secondary follicle plus antrum is equal to tertiary follicle. Now remember, in the tertiary follicle or secondary follicle or primary follicle, there is the primary oocyte is there. Primary oocyte is there. There will be primary oocyte is already there in the primary follicle, secondary follicle, and tertiary follicle. Now in the tertiary follicle, that primary oocyte will go into meiosis I, and there will be unequal cell formation. We call it as secondary oocyte. Remember, secondary oocyte, it is not secondary follicle, it is secondary oocyte. And secondary oocyte is haploid. It is haploid, and it is large in size. But in this meiosis, there will be also formation of the first teeny polar body. Very, very important. The first polar body in the meiosis I, in from primary oocyte to secondary oocyte, plus teeny polar body will be formed. So polar body we see in oogenesis, not in spermatogenesis, right? So polar body will be seen in female only. Now that secondary oocyte is there, and that secondary oocyte actually grows inside the tertiary follicle, and as well as in the tertiary follicle will convert into more mature follicle. Tertiary follicle will convert more mature follicle, or we call it as Graafian follicle. Remember, very, very important, Graafian follicle. So inside the Graafian follicle, there will be secondary oocyte. Inside the Graafian follicle, there will be secondary oocyte. Now once the size of the Graafian follicle enlarges, and lastly it will burst, and there will be release of secondary oocyte, what we call it as ovum. Secondary oocyte, we call them as ovum. That means female gametes are formed. So that process is called as oogenesis. Now here you need to remember very, very important, spermatogenesis at the age of puberty, but oogenesis since the embryonic age. There will be formation of the oogonia. That oogonia will go to the meiotic division, and there will be formation of the primary oocyte. Now the primary oocyte, along with this granulosa cell layer, there will be formation of primary follicle. That follicle gradually degenerate, reduces its number. At the age of puberty, the number reduces up to 60 to 80,000 follicles. So at the age of puberty, there will be only 60 to 80,000 primary follicle. Now with the primary follicle, when there will be granulosa cell layer plus theca cell layer, we will call them as secondary follicle. That secondary follicle, if they combine with this fluid filled cavity, we call them as antrum, then there will be formation of the tertiary follicle. Now remember, inside the tertiary follicle, there will be primary oocyte there. Now that primary oocyte will grow and divide, meiotic division, and there will be formation of secondary oocyte plus primary polar body, first polar body, right? Very important. Now this secondary oocyte and tertiary follicle both will grow. So then tertiary follicle will form the mature follicle or Graafian follicle, and inside this there will be the secondary oocyte. Now once that the size of the Graafian follicle is very large, so it will rupture and there will be release from this Graafian follicle, that is secondary oocyte, and we call them as ovum. That is the process of ovulation, that is the formation of ovum is the female gametes. So this is all about oogenesis. Now let us see the picture. Now you can understand. Now see, this is the ovary and you can see the primordial follicle or oogonia, right? Then there will be formation of granulosa cell layer. There will be formation of granulosa cell layer, and it is oogonia is there. Then we call them as primary follicle. In the primary follicle, when there will be fluid filled cavity, this is a fluid filled cavity, this white part is fluid filled cavity, what we call them as antrum. We call them as antrum, then we call them as secondary follicle. Now this secondary follicle, there will be formation of theca layer and granulosa layer, and fluid filled cavity. Here you can see the maximum amount of fluid filled cavity, what we called as antrum. If antrum is there, then we call them as tertiary follicle. In the primary follicle, only granulosa. In secondary follicle, granulosa plus theca cell layer, granulosa plus theca cell layer, then we call them as secondary. And if there is fluid filled cavity, then we call them as antrum, and that follicle we call them as tertiary follicle. Now the tertiary follicle, inside this tertiary follicle, you can see there is a primary oocyte is there. Now it will grow, it will also grow, and that the tertiary follicle also will grow in size. Now that the tertiary follicle will rupture, and the primary oocyte will convert it into secondary oocyte, and there will be release of ovum, and the rupture of the Graafian follicle leads to release of the ovum, and that ovum will be taken up by the fallopian tube for the fertilization. So this is all about your oogenesis. I hope this video is important for your exam and you are very confident about this oogenesis. If there is any question, then definitely you can write down. I will try to solve your query in the message or chat box. Thank you so much.